Thanks for joining us for Healthline 3. I'm Wendy Redman. During the holidays, it's always a good idea to keep an extra eye on the elderly. And today we're talking about some of the common problems they have. Dr. Wolcott from Urgent Care is here with more. He's going to be answering all of your questions about this for the next half hour. So we really want to encourage you to ask all of the questions on your mind. If you're online, just fill out the information on your screen and submit it. Or you can always give us a call. That number is 318-219-4569. We're going to be taking all of your questions until 12:30 as always. So first of all, doctor, what age would you say people are considered elderly at?
There's a few different opinions. However, 65 is generally accepted as a normal. Some people will say 70 and others go down as young as 50. However, I think with the way healthcare and the way health is improving in general, that most people agree 65 years old.
Okay, so what are some of the things that happen to your body at that age that make it tougher for you to recover?
Some of the more common things that we hear about are bone density changes, such as osteoporosis, other illnesses or diseases that might start to rear their heads, including high blood pressure, heart problems, heart attacks. A lot of people will notice a decline in visual acuity or how clear they see things. Hearing can decline, and with those can lead to balance problems, coordination problems, loss of muscle mass, and strength as your hormone levels begin to drop. So all those are pretty common as we get older.
And so a lot of those seem to relate with falling a lot. And you said earlier that that's one of the biggest problems you see in elderly folks.
The number one cause of trauma in the patient over 65 years old is due to a fall, and just not tripping or not falling downstairs, but just falling from height or from a standing position. Most likely caused by an object getting in the way, bumping of a leg on a coffee table, hooking their toe on a carpet or a rug that's in the house, slip on a surface. And many people in their 20s and 30s or even younger would be able to compensate for that. Their brain would react, their balance centers are better, they can visually acclimate to where they are in the world and right themselves. And the reaction speed as you get older, the vision and the balance centers in the ear, they age just like the rest of the body. And so we have to take that into consideration when we're mobile and active. A slight little change or a nudge in one direction or the other might send you over the edge and fall to the ground.
Okay, we've got a caller on the line. We have Mary. Mary, what's your question?
Mary.
Mary, you might want to turn down your TV a little bit so we can hear you better.
Okay, I just discovered that I have osteoporosis, and the vision problems and standing up straight, putting my foot down. I'm having a lot of problems with that, but they say that the doctor told me the medicine that I have to take for it is bad for my esophagus. So I don't really know what to do.
Yes, ma'am. Thank you, Mary, for the call. The loss of bone density and bone strength is, I believe, what you're referring to, and one of the common medications to help combat this is a medication called Fosamax, and it does have quite a few side effects for the esophagus. Now, usually that can be taken care of by just drinking a full glass of water with your medicine, which is good to do with any medication. However, Fosamax is one of those medicines where it's imperative to drink a full 8 to 12 ounce glass of water to make sure that medicine goes all the way down to the stomach, because it is notorious for getting hung up in the esophagus and can cause burns. So if you have swallowing problems from maybe an unrelated medical problem, that would probably not be the best medication for you. However, typically drinking the water will help get it all the way to the stomach, and then hopefully help with your bone density problems.
Thank you, sir.
Yes, ma'am. Thank you.
Thank you so much for calling in, Mary. If you have a question, give us a call, 318-219-4569. We're going to be taking all of your questions until 12:30, so give us a call. All right, so back to falling. You're saying that this is one of the major things that you see. Now, when people wind up hurting themselves, what kind of injuries are we talking about? The first thing that comes to mind when I think of old people falling, I think of, their hip going out or something to that effect.
One of the orthopedic injuries are number one, whether it be a hip fracture is a very common and very serious one that we see. However, we also see rib fractures, which can lead to bruises of the lungs lying underneath the ribs, and which would lead to difficulty breathing, of course, and sometimes associated with a poorer outcome overall of healing. Spine injuries are common, and other fractures to the extremities as a patient tries to catch themselves when they fall, and the bone not being as strong is more subject to trauma and a fracture. The other injuries that we see are head trauma. As we get older, we know for a fact that the brain does lose volume, loses size inside your skull, and it actually becomes fairly adherent to some of the linings around the skull, the protective linings, and as the brain shrinks, the little blood vessels that feed the brain are stretched a bit. Because they're now having to span a further distance to get to the brain. And when you fall, your brain will actually have the ability to move more inside the skull and put you at risk for tearing one of those small veins and cause a bleeding around the brain. In fact, it can be a very devastating injury, and sometimes occurring from a seemingly innocent fall. Maybe the patient didn't even hit their head, but caught themselves and just stopped abruptly.
Yeah.
But typically we see it with people who have hit their heads. And we also have to worry about many of our people over the age of 50 are on blood thinning medications for various problems, heart problems and blood clotting issues such as a clot in the legs or in the lungs. And we thin the blood out to prevent and treat those clots. Well, the dangerous side of that is if you hit your head hard and cause bleeding, the bleeding won't stop as readily. And so when a person who is on these medications does fall and hit their head, it usually warrants evaluation that includes a CAT scan to see if there's any bleeding, because sometimes it can be a very slow process, the bleeding can be, and symptoms won't show up for hours.
And recovery is a lot different as you age too, so having the same injury in your 20s is not going to be the same thing when you're 65 or older.
Definitely not. Again, the most important point is going to be prevention. If you can prevent the injury or the illness, that's going to be your best bet. However, if you are unfortunate and do break a bone or have to have surgery to have a bone repaired, your recovery process is going to be much longer. Your energy levels, your what we call reserves. What do you have left in the tank to fix these bones? The repairing process, all the little cells that come in and rebuild the bones, they don't work as well as they used to. You might not have as many, many people actually, with their injury, other issues will happen. I mean, maybe somebody's had a family member that had to go to the hospital and they stop eating. Well, it's because they don't want to be there. And so even a level of depression can set in. And all these things will play together. If you had heart disease and your heart doesn't beat as strongly as it used to, or the inability to respond to trauma to the body requires the other systems of the body to pick it up, to pick up the pace and start with repair process. And if those aren't working as well, then you can imagine that the body will not heal as well.
Any foods that we can eat, any vitamins, any supplements, any exercises that the elderly can do to help boost their healing?
I'm a firm believer in the old saying, an apple a day keeps the doctor away. There's truth in that saying. And what that truth is nutrition. Of course, getting with your primary care doctor about supplements as far as vitamin D or calcium, finding that in the foods that we eat and milk and dairy, those can help with bone regrowth, because those are the building blocks of bones. And if we're not getting enough of that, and you're not supplying the body with those building blocks, well, then the body has nothing to build with, and it won't repair. So keeping that good digestive health, keeping the body systems working, trying to stay mobile, keeping the blood flowing, so to speak, are all good points to take home. And that's where family and support network comes in so importantly, to get their loved one up out of the bed, up and moving, keep the blood flowing so you don't make blood clots, because a lot of times it's not the injury that causes the major problems, it's what happens after the injury, and the activity level goes from up here to down here. And and the human body will show you that it does not like to sit still. The human body wants to move, and it's the whole principle of use it or lose it. And so if you can get the people up, get the energy levels up, that helps out. And what you said about exercise, and it would depend on the injury you have, but some form of physical therapy needs to occur as soon as the patient is stable enough to do it, whether it's exercises with weights, stretching. Sometimes physical therapy, the best part of it is getting the patient out of the house and to the physical therapist, and in the sunshine, and with family, and with people there exercising with them. And it brings the energy level up, and it just overall helps the whole process of healing. But physical therapy is extremely important, any kind of injury. And then we even have such types of physical therapy for recovery from illnesses, severe pneumonias that hospitalize the patient. Sometimes we move them out of the hospital and into a step-down unit, or a skilled nursing facility, or even a nursing home temporarily while they're getting their energy levels back. And it has to be very important that the patient knows this is not where you're going to live now.
Right.
This is for a week, maybe 2, while we get your breathing level, get your lung capacity back up, make sure that you're eating well, maybe have the family come in and check the house and secure it, and maybe install some rails in the bathrooms. And you're not giving up your life. You're getting back to your life. And another good saying is a stitch in time saves 9. Let's fix this one little thing while it's little, so it doesn't become a big thing that we can't fix later.
Yeah, good points. Well, what about this? I know a lot of elderly folks don't maybe have the appetite that they used to. I know my grandma, she gets overwhelmed if she goes to a restaurant and just sees the plate of food that they serve, and she just doesn't even want to even attempt to eat any of it. And so her doctors worry, you're not getting enough of the nutrients that you need because you're not eating enough. What would you say for those folks?
There are aisles and aisles of vitamins in any drugstore, and whether you're a believer that they work or whether you're a believer that they don't work, is fine. I tend to take 1 vitamin a day. You don't really need any more. But when it comes to a meal, that's where our full nutrition should occur. We should be absorbing it from a variety of different groups. And we all know the food pyramid, with your vegetables and fruits being your major servings, and then a few servings of a meat or dairy, a cheese, and then maybe 1 serving a day of a carb or a sugar type meal. The important thing would be presenting the patient with something they like to start. Or finding, is there another reason why they don't want to eat? Does it hurt when they eat? Maybe they've got some gallstones that they just haven't fully figured out yet, or maybe an ulcer. And so eating causes pain, and so I'd want to know that right off the bat. And if that wasn't the case, then I would work with smaller portions. You're absolutely right. As we get older and we get smaller, and we're 100 pounds, and we don't need 2,000 calories per meal, it's time to scale back and bring in things that they would like. And sometimes just a simple internet search will show you the foods that have the daily requirements that you need. Looking up a geriatric diet, and do it from a website that may be sponsored by the American Medical Association or the Geriatric Association. There's plenty of information on the web to help with that, and because what people like later in life isn't always the same as what they liked earlier in life, and so a big steak or a big huge pile of whatever is probably not appetizing anymore. And so we go smaller, and maybe if you have to, go more frequent meals. And then there's a lot of proponents and a lot of who support nutritional shakes. Not to plug anyone, but the one that comes to mind is Boost. And those are great supplemental sources of nutrition, because most of them are extremely palatable, and they're good. And they take 5 minutes to drink one down, and that's basically a meal. And that can be a great source of nutrition for somebody who's not eating quite as much.
That's good advice, because especially with Thanksgiving right around the corner. So if you have, you know, maybe grandma, grandpa, mom, dad visiting for the holidays, and maybe they don't like to eat as much, just, you know, keep it coming. A little, you know, more frequent but smaller meals might be a little bit easier, like you said. And also during the holidays, it can be a really tough time mentally, because I know a lot of older people have a lot of lost loved ones, and this can be a very emotional time. What would you say to them? How can they get through it, and then what can we do to help?
This is an extremely important topic. About 85%, I'm sorry, I correct that, about any person the age of 85 years or older has a suicide rate that is twice that of the general population. And sometimes their symptoms, just like many medical problems, aren't quite as obvious as when, say, a young person's depressed. Young people will cry and become angry at different situations, or become withdrawn. And an elderly person, they might have withdrawal, and you just think they're tired. But many times an elderly person will complain about aches and pains. They will complain about just not feeling well, and then they'll have a change in their cognition. They might not be as sharp as they used to be, or even their level of functioning will decline. They're not taking care of their house anymore, not keeping themselves clean, and it's not because they can't do it. It's gotten to a point where they don't want to do it. And there are 2 questions that are recommended that you ask, and it doesn't have to be a healthcare provider to ask this. They're very simple questions, and it is basically it's, do you still take pleasure in the things that you do? Or another way to ask it is, over the last 2 weeks, have you lost pleasure in the things that normally brought you pleasure? And if they answer yes to that one, or if they answer yes to this question, and this one's a very direct question, in the last 2 weeks, do you feel depressed or hopeless? There's no way to get around that question. There's no way to chalk it up to being tired. If they answer yes to that question, then that needs to be further evaluated. There is a high successful suicide rate in this population, and people think golden years, oh, this should be the best time in their lives. Well, you got to remember, many people are lost spouses. People may have been married to for 30, 40, 50 years. They're dealing with the fact that some of these might be the last holidays. Family has moved away. Financial burdens, fixed income financial burdens are unbelievably stressful. And then another big one is mounting medical problems. You have severe heart disease, you have congestive heart failure, and now you can only walk a block before you get severely short of breath, so now you're kind of stuck in your house. Well, are there things that we can do medically to help you get back to that level of functioning that you want to be at, or do we need therapy and intensive psychiatric evaluation, because it is very real and very serious.
Yeah, well, I would assume it would be very, very normal for somebody to feel very upset during the holidays, especially if they lost a spouse or a child. But how do you know if it's something more serious than that?
As far as when they have what we call anhedonia, which is a definition that we use in the medical field that means takes no pleasure in anything. And typically it's going to be something like, my grandfather used to love to go hunting, or my grandfather used to love to go walk around the neighborhood, even simple things. He'd go to the mall and walk around the mall and then people watch. All these different activities they do, they stop doing them. And if it's not because, oh, it's just my hip hurts, well, okay, let's see if we can get that fixed. We'll get you back out there. But if they just say, I don't want to do it anymore, I don't take pleasure in it anymore, that should be a red flag that there is something going on. And if you take that information and then couple it to the population that you're talking about, then those are 2 very large red flags that should be taken very seriously.
What about if mom, dad, grandma, grandpa say, oh, this has been hurting me for a while, but this is just what happens as you get older. A lot of folks, I hear that over and over and over again. They'll just say, well, this is just a common thing that happens as you age. How do you know when you should trust them and say, okay, yeah, that's going to be no big deal, and oh my gosh, that's a huge deal, we need to get you to the emergency room?
That's a tough question because, as we know, our baby boomers who are now 60, 70, 80 years old were a tough generation.
Yep.
And so some are very stoic and won't complain. And so any complaint should be taken seriously. Always take it seriously, but that first time complaint should at least generate some questions and maybe how long has it been going on. And if they say, oh, my knee pain's been kind of hurting a little bit more and more over the last 6 or 12 months, it might not be an emergency right then. But I think any complaint that they're having that may be something slow and indolent and growing needs at least one evaluation to confirm that, yeah, it is arthritis and you are getting older. Or it needs that evaluation to go, no, look, we just found a problem. You have a bone spur that we can remove, or some of the other more devastating illnesses or cancers even. If you don't have that one evaluation to look at it, then you'll never know. And it may have been something that if you would have looked at it today, in 2 years when it's out of control, we might be able to do something about it today. But if we put it off and say that's just aging, and don't get at least the one evaluation to confirm that, then we could put the patient at a disadvantage. And also too is if you have that chronic complaint, months and months or years of back or knee pain or indigestion, and it suddenly changes. It goes from, wow, it used to just ache, now it's really, really sharp pain in my belly when I eat. Well, that should warrant a reinvestigation. Even if you've had one investigation and the doctor just said, oh, you're fine, just upset stomach or indigestion, you're going to be fine, take some antacids. But if it changes and you say, oh, wow, some things are really different now, it warrants another investigation.
Yeah, you have to be your own advocate, and sometimes we have to be that for our loved ones because sometimes they're not going to do it on their own. Like you said, it's the generation that doesn't complain. And
people getting to this age are very independent, and they should be. And there is a fear of losing that independence as they get older, and it's real in the back of everybody's mind that I don't want to be put in a nursing home because it's a terrible place. Well, that right there is not true. I mean, there are wonderful places to spend life in a community of peers, which is important. But if they are still independent and don't want to go, some fear that is going to happen. They're going to put I'm going to get put in a nursing home, and that should never be true. Nursing homes serve a great purpose in our community, and certainly are wonderful alternatives to when the patient and the family are beyond their capabilities of handling the medical problems, and it gives them that medical and that environmental protection while still maintaining independence.
Yes, big time. Okay, we have another caller on the line. What's your question? You're on the air.
Hello.
Hi, you're on the air.
Hello.
Hi.
Yes, ma'am. I would like to know, I have a problem. I can't smell, and I'm a hypertension person. And I was wondering if that got anything to do with age, or it's just a problem I have.
Yes, ma'am. The sense of smell is what you're having a problem with? Is that correct?
Yeah, can I hang up and listen to what you tell me?
Yes, ma'am.
Sir?
Yes, ma'am.
I can't hardly hear you with the TV on.
Okay, yes, ma'am. That would be fine.
Okay.
The sense of smell, like all the senses, can decline in its acuity and how good it is over the years. I think the more common ones that we come across, of course, are hearing and vision. And we forget about the sense of smell sometimes. There can be a couple reasons for that. One would be the aging process has affected the nerves that are in the nose, and you are just losing your ability to smell, and that would be, just like we were talking about, a consequence of getting older. However, I would be interested to know what medications you're on and to know if any of those have a side effect of altering your sense of smell. Sense of smell is very important to pleasure in life. I mean, it is one of the most important senses when we eat. We like to look at food, and food likes to be visually appetizing, but it likes to taste good. But the majority of taste actually comes from smell, and so there would be that could be a reason why somebody has stopped eating as much. It's just not palatable because they can't smell it. But I would definitely, as we get older and get more medications to take for different complaints, and then you get another medication for another complaint, and another one, and another one, I think we forget about side effects. And the sense of smell is one that we forget about. And so I would definitely either talk to your pharmacist or your doctor about the possibility that a medication is changing your sense of smell, and see if you can come off that medicine for a period of time, maybe to be replaced by another one if you're treating blood pressure, and you certainly don't want to just quit your blood pressure medicine, but maybe your doctor has an alternative, and maybe that will bring your sense of smell back. But those would be the two main things. One is aging, and number two is medication reaction.
Okay, well, while we're on the senses, talk to me about hearing loss. That seems to be a major one that most everybody deals with. I mean, at a certain point, it's just not going to be where it was before. And I know a lot of people worry maybe about getting hearing aids, or they don't feel like that's something that they want. Talk to me about that.
The loss of hearing is fairly widespread. It's not a given that you're going to have it, but at some point, many people will be faced with that. The best advice I can give for that is that hearing aids are tiny now. They are so technologically advanced. We have some that you can actually answer your cell phone through now, and they Bluetooth to your cell phone, and so that you can hear your phone calls. However, it's also from a safety point. You need to be able to hear if there's a car coming up behind you, or a dog is coming up behind you. But more importantly, just enjoyment of life. To have a conversation with somebody, and we all have had the family member where we have to speak 3 or 4 times louder than we would normally conversationally to have the person hear you. And if you think it's frustrating for you to have to speak that loud, think how frustrating it is for the person who can't hear you. They know that it's kind of they feel like a nuisance that because they're making people speak so loudly. And so what I can tell you from the patients that I've met that have gone and had hearing aids placed, and some fit just in the ear, some fit around the ear, but they're very small. And but when they get them and they have a normal conversation with a family member, it's night and day, and almost every single patient goes, "Why didn't I do this sooner?" And so you can't look at it as a handicap. It's not even close. It is just getting back to life and getting back to that enjoyment in life that does not have to decline just because you're getting older.
Yeah. Okay, well, we have a few minutes left, but I really wanted to talk about this because Thanksgiving is right around the corner. I know a lot of people are going to be hitting the roads. At what point should you say, Mom, Dad, Grandma, Grandpa, you cannot be driving?
This is another very tough one. Again, this goes back to taking away their independence, and that's not the goal. The goal is to have them participate in life, but do it safely. Because if they have trouble going downstairs and fall and break their hip, well, there's a lot of mortality or death rate that goes with that from a simple broken bone. Cars are no exception, and so if they are having difficulty with vision, especially nighttime vision, if they can't hear other cars or sirens or horns, all those will lead to the potential for danger and having a crash. And if you're injured in your car, your mortality rate over the age of 65 is extremely elevated when compared to doing it as a young person. The American Medical Association actually has a link on their website of a questionnaire and things to look for that you could sit down with your loved one and discuss it with them from a medically speaking standpoint, not I don't want you behind the wheel anymore, Grandma, because you're going to kill somebody. No, it can show, can you read this sign from this distance, or can you hear, and how is your hearing test and vision test, and it's in depth. And it's an effort to show the patient that, hey, you're endangering yourself, and you would not want to hurt other people. I know you wouldn't, and so this might not be the best activity. And then offer alternatives of, let me help drive you, or we'll get all the family together to set up a service to get them to and from where they need to be, because again, you don't want to take their independence and their participation in life away.
Right, and that's a good way of putting it, because then you're not saying, no, you can't drive. It's showing you, okay, well, listen, you have this, this, and this, and this. Do you think that you're a safe driver?
Right.
You know, and this is what, you know, the medical professionals are saying is at a point where maybe we need to talk to your doctor about this.
Exactly.
Yeah. Okay. Well, these are all really great tips, because I know with the holidays, everybody wants to stay safe and we want to keep our loved ones for around as long as possible. So thank you so much for coming in. If people have extra questions, do they have a phone number?
Yes, it's 868-2273.
All right. Well, have a great day, everybody. That'll do it for us.